6:11. Medical emergencies can happen at any time, but what happens if you're unable to make decisions for yourself about the treatment you want to receive? As part of our Ask the Expert series, 7 News anchor Kelsey O'Donnell spoke with a professional from Bon Secours about making medical decisions on behalf of a patient.
It's a conversation that can be challenging to have.
Anybody that is 18 years of age or older really should be having these conversations with their loved ones, making sure that their healthcare wishes are known and what they would want in the event that they couldn't speak for themselves.
Who will make your healthcare decisions when you're incapable of making them yourself? Montana Lucas with Bon Secours Advanced Care Planning has seen firsthand what can happen if you're not prepared.
Really making sure that whoever you're naming is willing to honor what your wishes are and not just what they think is best in a certain situation.
Health professionals say a number of times people may have an idea of when they're going to need to step in and make decisions on your behalf. However, there are emergency situations that could force caretakers to step in quicker, which is why selecting the right person is vital.
I always say it's really important for you as the individual to think about who could speak for you and would be willing to honor your wishes. Being a medical decision maker isn't always easy. Sometimes those decisions are having to be made in a high stress situation when emotions are high. So making sure that that person that you're going to name is able to take that role on.
Health experts say selecting the right person takes time. Here are some things to consider.
Are you comfortable with this person knowing your healthcare wishes and knowing information about you and talking with your doctors for you?
Lucas says it's also important the individual will advocate for you and your needs, and they should be accessible in the event they're needed quickly and unexpectedly. Legally, health experts say it's not required to have the power of an attorney in play, but having something in writing on your behalf could be beneficial.
We really do encourage you to put your wishes in writing, to put them in a legal document, but there is kind of the legal next of kin hierarchy as well if there's an absence of that document.
If something happens before you can select your decision maker, a team of experts say they will help.
If nobody is stepping in and that patient can no longer make the decisions, a healthcare team is really going to try and do everything they can to find someone in that legal next of kin line to be able to step in and take that role on as that decision maker.
Health experts recommend reviewing your decisions annually and making updates if you have any major changes to your health. For this week's Ask the Expert, I'm Kelsey O'Donnell.
If you have questions about who will make medical decisions on your behalf, visit mylifemychoices.org or theconversationproject.org. And remember, you can submit a health topic for our Ask the Expert series. Go to WSPA.com, click the News tab, then Ask the Expert.